in transforming healthcare. You need to lead the process. I believe that all healthcare reform that works has to come from within, has to come from within the system. It has to come from the people in the system changing the way they do business, the way they provide care. And it's that question of how to transform healthcare delivery that I'd like to talk about this evening. I'm not going to talk in too much detail about the Brazilian system. I know quite a bit about it, but we have an excellent panel that will help us kind of dig into some of the detailed questions that you're facing here in Brazil. What I'd like to do is give you the international perspective, drawing from examples from all around the world, to really see if I can give you a picture of where we need to go in terms of healthcare delivery. This is a subject that I came to relatively later in my work. Of course, I'm a strategy professor at the core, but now for about 10 years, I have spent the majority of my time very focused on healthcare delivery. I've been in hundreds of hospitals. I've met thousands of physicians. I know just enough to be dangerous. So, but I think what I'll be able to do this evening, hopefully with you, is to give you some fresh ways of thinking that perhaps somebody who's not so close to the healthcare system perhaps can shed some light on the question. So let's begin. How do we think about healthcare? What's the problem in healthcare? Well, I think Brazil has, like many countries, gotten some critical parts of the healthcare system moving in the right direction. As I said a minute ago, you created a universal system. It's not perfect. It's not covering everybody the way we would like. You've created a system that's pretty equitable compared to all other countries like you. That's been a tremendous step forward. Those are good. You spent a lot of time thinking about how to improve the efficiency and control the cost of the system. Lots of nations are doing that. And now the challenge is value. Now the challenge is how to create a system that delivers more value. Just covering everybody is not enough. The real fundamental question in healthcare is actually to improve the value of the care delivered. And what do we mean by value? By value, we mean the outcomes that the patients achieve, or the citizens achieve, per dollar spent. We can't just keep pouring more money into the system. Aging populations and improving technology will create a financial disaster. We've got to improve the value. We've got to get better outcomes for the money we're spending. We've got to find a way to get good outcomes more and more efficiently. That's the fundamental challenge. Every single country is facing this challenge. Whether it's the US or France or Sweden, this is what everybody has to worry about. The question then is, how do we design a high-value system? What does a system look like that delivers excellent outcomes really, really efficiently? What does that look like? What I've come to understand is that question really is almost independent of the ownership of the system. Whether you're a Swedish system that has municipal hospitals owned by the government, or whether you're a U.S. system that has a lot of non-profit private hospitals, or whether you're other countries where they have for-profit hospitals, who owns the system, who owns the provider, that's not so important. The issues of value cut across every system and are relevant to every system. How can we think about the kind of healthcare delivery system we need to have in order to substantially improve the patient outcomes and do it all much more efficiently? Now, in order to do that, I have come to the conclusion, after a lot of work in many countries, that in order to create a very high-value system, we can't just improve the way we do it today. See, this is, in a sense, the fundamental problem. What's been happening all around the world is various countries and various organizations have tried to make incremental improvements on the existing structure. The existing structure has, primary care, and it has hospitals, and hospitals are organized typically around departments and specialties, and there's a typical structure. And what people try to do is they try to make incremental improvements. For example, safety. A lot of efforts around the world to reduce errors. So you keep the system, but then you have a program to reduce errors. There's efforts at disease management,